请3问讯礼，1问讯，再问讯，3问讯。
Pay respect to the Buddha and the third
请
bow.
合掌。
Please place your palms together. Everywhere. Everything. 海洋、海象，那怎么讲？是让一个 所以莫桑比克是我美国就是你
你要这样分对不对？
因为他说他可以
我要想要看的耳机，
那耳机不要用
那我们其他人都要安静的，不能像以前那样。
Nourish the purified mind, and we hope that the society free of disasters. And sincere love and care is the
向上
biggest
向佛菩萨行问讯礼，
shelter of our mind and spirit. And let's pay respect to the Buddha.
三问讯
First bow, and the second bow,
大家
and the third bow.
亲爱
Please
的
be
上
seated.
人、金舍师父、各位大医王、师兄
Dear
师姐
Master
大
Chen
家
Yan and Dharma Masters
祝
and
同诚心
and
意，借着全球人医会的因
brothers
缘，
and
能够回来
sisters,
平安今年 TIMA
I'm
司仪的
Hong
工
Xin
作。
Yi,
在今
the
天活动一
MC
开
of
始，我
the
们要请
TIMA.
置业的林俊龙执行长来为我们
And
说
at the
解。
beginning, we're going to invite our CEO of Xijing Medical Missions, Dr. Lin, to share with us.
金色师傅们，还有各位
Dear
慈济
Masters
人医会的伙伴们，大家下午好。
and dear medical
今年
staff of our
我们人医年会
TIMA.
跟往年不大一样，因为疫
And
情的
this
关
year,
系
the
啊，
TIMA conference is
海
quite
外
different from
我们的
the
人医
previous years
不上
because
没
of
有
the
办法回到花莲，
pandemic
所以我
outbreak.
们
And
改
this
变
year,
了一
the
个方式。
our
那么透过
our
视讯的方
fellow
式，
our
可以
fellow medical
普
staff, they
播放
they
到
cannot come back to
全球
Taiwan to
每一
join
个
our
角落。
conference. So
很
this
难得
year,
的是，
they
我们今年呢
connect with us
参与的
through
人
the
数
internet.
比往年还要更多，多出
And
好几倍。
this year,
我跟大
the
家简单说明一下
attendees online is
我们在
the
台湾呢，
attendees
台
number
湾
of
一共有
attendees is
260
more than the
北中
attendees
南东
the in the
各区的
previous
人
years.
医会
This
成
year,
员
the
会来参加，这
the
是协
attendees
员哦，
are
不包括工作人员。
more than
另外，我
200.
们工作人员有387人在台湾。那目前
And
呢，
there are
上线
more
的
than 300
24个国家
volunteers.
地区，
They're
一共有
they're
2200
serving the attendees.
对不起，1560
And there are
在海外的线上哦，跟我们
there
一起连线。
1,500
不计
right
算
now.
工作
They're
人员
online to
学员
to joining and listening to this
一共
conference.
2208学员。
And there
那往年呢，因为
the
座位的限
attendees,
制，我们在
the total number of attendees
学员
are from 24 countries.
因为我们还有队服，还有工作
And
人员
in the previous years, because there the limitation of the space, so there
多了哦，这个是不容易的一件事情。
so this year the number of attendees are 3 or 4 times more than the attendees in the previous years.
大
So
家来报告一下，
today
参加人数最
to
多的呢
we're going to
是
share
美国的407人，第二个呢是大陆，目前
this year there are more than 4
再加
there
下
are
来
more than 400 attendees in the United States and more than 300 from China and Taiwan,
还有
about 200 in Taiwan
一
and
共
Singapore,
请合掌。
Singapore and Malaysia. And please rise, Please place your palms together.
向上人行问讯礼问讯。
Let's pay respect to Dharma Master
人
Cheng.
好，
Dear Master Cheng,
那马来西亚
please
吉
be
隆坡
seated.
182人，不，
And Malaysia,
马六甲182，吉隆坡是110，那印尼
Malacca,
104。那么印尼呢，他们明天会做一个完整的报告。
Malaysia, more than 104 attendees. And tomorrow they are going to share what they have done in the Anke River area. And Philippines, 48 attendees. And from Canada, 41. And there are many staff online who's joining our conference. And this year, we asked Taichung City Hospital to help us to arrange the conference this year.
希望各位菩萨们都能够将在比较这个安静的环境底下来听我们的
And we hope that we could join our heart together online, and we hope that you would you would like the arrangement of the conference this year that are arranged by the City Hospital in Taichung.
危机呢也是
And thank you.
那接下来呢，我们要请由这次主办的台中慈院的简守信
Also
说几句话。
And let's welcome Dr. Jen from Taichung Tzu Hospital. Good afternoon, everyone. And this is a very special occasion that and we meet each other. We meet each other online, and it's just like the auspicious cloud that that we meet each other online. And so the content of this conference will cover what's happening in the world this year about the pandemic and what we have done and what we learned from this during the pandemic prevention period, and we hope that we could learn from each other's experience. And today we're in the Jingsi abode, and tomorrow we are going to be in the Jingsi Hall in Hualien. And right now, there are more than 200 our attendees are in Jingsi Hall today. And this time we prepare. We not only prepare the content of the conference, and this year we also prepared the review video clips about the our medical staff from TIMA, and we hope that we could learn from their experience and this role model, what they have contributed to the world. And this now it's the period, it's the autumn festival as the time for reunion. And in 1996, Dr. Liu Xiuquan from Philippines take the free clinic team from Philippines to come back to Taiwan to visit Dharma Master Cheng, and that was the year that the TIMA started. So Dr. Liu Xiuquan has served the Dharma free clinic all over the world since then. No matter what the condition of my health, I'm willing to contribute my knowledge and medical service everyone until the last minute of my life. Dr. Liu Xiuchen from Philippines. He's the first TIMA member overseas. One day, Sister Xiaozhen came to my office and she asked me whether I could help her to organize a free clinic team. That's a simple question, but it takes a lot of work. So, Dr. Liu Xiuchen is a Catholic. I asked her what kind of organization you are. I've seen that she wear the blue uniforms. She say we are the Buddhism organization from Taiwan. We're called Tzu Foundation, and I wonder why she came to me because I'm a Catholic. 1996, the Autumn Festival. They came back to Taiwan to visit Dharma Master Zhen Yan. And Dr. Liu Xiuchen finally realized that the Buddha is in everyone's heart. In 2008, it's the anniversary. I insist I'm going to join 200 free clinics, 200 times. In my lifetime, I'm going to serve in the Tzu until the very last minute of my life. We're very grateful for the Dr. Liu to contribute his heart and his love and Tzu. And this year we have the members are in Master Zhen Yan's conference room, and Dr. Xie Jinglong and Dr. Wu from Hualien, and from Dr. Ji Banjie from Taichung, and we also have members from China online and from Vietnam and Thailand, Jordan, Singapore, Malaysia. And let's wave to Master Zhen Yan. Greeting to Master Zhen Yan. And we're very grateful that this year the TIMA conference, we conducted a conference online. And the first period of the conference is there are 7 teams that conduct the sharing from 7 countries. We're going to review share our experience with one another, and that's connected to Dr. Long from Mozambique in Africa. Dear Dharma Master Zhen Yan and dear Dharma Masters in Jinsabot and Tzu family online, I'm very grateful. I have these opportunities to do my sharing online, and this is my first experience to do the sharing and TIMA conference, and also it's my first experience to conduct this the sharing online, and I'm very grateful that my heart is at home in Hualien. I'm going to share the last year because the Hurricane E died. I went to Mozambique and I started my free clinic service in Mozambique. We offer the service to the community, and we also offer the service to the clinics, health center, and also we also help the volunteers for the preventive measures. And it's very, very challenging and a lot of work. And in March, we started teach our volunteer to use the mask and wash their hand frequently. And although they learn that they need to wear mask, but it's not affordable for them to buy mask or hand sanitizer. Although $20 is not much, but they could buy a piece of soap, and also they could buy 1 kilo of tomato, and they could buy 10 bananas. In the community, they were too poor to even afford to buy food, so they cannot afford to buy soap. So the government acts teach the people to use the ashes as soap to wash their hands. And it's very hard for us to imagine that they use the ashes to clean their hands. And it's not easy to clean up their hands because they're use the ashes to clean their hands. Their hands are still dirty. And so to encourage our volunteer to wash their hands, we need to give them soap. And so we give them the preventive healthcare kit. We would give them soap, and we also give everyone a cloth mask. And so volunteer need to learn how to take care of themselves, so they can stay healthy and be able to help others. And the volunteers, they are very poor. They don't have cell phone. They don't have the internet connection, so they have very limited knowledge about the pandemic of coronavirus. So the government asked the volunteers to go into the community to teach the community members about the knowledge, to share the knowledge about the pandemic and how to and there are many elderly in the community that really do not have any idea about this coronavirus pandemic. And there are about 8,000 confirmed cases in the community, and it's very risky to go out to teach people to share with people about this, how to take care of themselves. The volunteers, they are not afraid because there's love in their heart. And also they know the preventive. They know how to take care of themselves. They know how to. They wear masks to go out to visit people in the community. And we also take care of the health centers and orphanage and the university, and also we also take care of the bus drivers, and we also help the students from the university so that they could return back to school. And we're very grateful that the CEO of Dr. Lin helped us to get connected from the Darling City Hospital and the support from them, and then we share they share their experience for us with us online. And in Mozambique, the most difficult situation in the Mozambique is because the poverty is in the Mozambique, and although you seeing doctors is free, but they cannot afford to buy any medical any drugs, or they cannot afford the prescriptions. So they even after seeing the doctors, they cannot they don't get any treatment. And take a look at the pictures online, and they just have to go back home and wait. It's very hard to recover. And after 10 days, Dr. Long take care of this little child. His wound was cured after 10 days. This is a picture of the wound on his leg, and now this little boy, he become our little volunteers that he help out, and he also would like to also help us to promote vegetarianism. And there are also people in the Mozambique, they cannot afford the medical care, so they believe in alternative medicines. And this, they put herbs on their wound, and it becomes like the herbs, they become like a rock and attach, stick to the skin. And there's an infection in the wound. This is and although sometimes their wounds are not very severe, but they need to, because they lack of the they don't have they cannot afford the medical care, so they believe in alternative medicine, and their little wound becomes severe. So in Mozambique, it's very important for us medical profession to teach the health knowledge to the local people. So we need to teach them the knowledge of the how to take care of themselves in a proper way. That's the best approach for them to stay healthy. And the carrot for the people in Mozambique is very expensive. Carrot is very expensive vegetable in Mozambique, and health is more important than the money and food. And the most beautiful the most the most beautiful face is just smile on a patient. I and it's very important to have the medical staff and medical profession to serve in Mozambique. And I'm very grateful I have this opportunity to offer the Love FM in Mozambique. And I'm very grateful that I'm to see the smile on the face of patients, because there's love from Tzu and there's teachings and love from Dharma Master Chen Yan. We overcome difficulties to share, to learn experience from Tzu Darling Hospital, and also we overcome difficulties to get preventive the preventive healthcare kit. So thank you. I'm very grateful that I have opportunity to relieve the suffering in Africa.
And now let's have Mr. Ge Jise from South California, and we have Deng Boren, and let's go through them. Dear Memorable Master Zheng Yan and masters and all the volunteers of Tzu, good day. And this is Ge Jise, and now I'm reporting to you what we are doing at the Tzu America. And 2019 was the 30th years of the medical mission in Tzu, and we've been doing our best to do our best and deliver the relief job in America. So we do the fundraising and everything we can do. And we are really diligently studying all the efforts of the medical mission. And with the help of Master Deman, Dechen, Dekan, and Dexiang, so we can achieve all the missions with all the doctors here and all the staff right here. And we have over 400 people participating in our medical dinner right here in the United States. And we also have the performance right here. And we have so many guests, and we make them really touched. And for the International Free Clinic, and it is going to be the great efforts for there. And we help Mexico, and we help a lot of patients there, and we cultivated a lot of talent in the medical field. And we command the U.S., Canada, and Taiwan, and all doctors, all over the world. And we held free clinic for many times, and we mobilized more than 3,051 doctors and more than 10,000 volunteers in the service. And what is precious, what is really precious, that is there are many big events of Tzu, and we still tried our best and accomplished all the tasks there. And what we did are like a free clinics for teeth, for eyes, and for a lot of medical services. And due to the pandemic in 2019, and we still did our best, and we didn't stop there. And here you can see is the optical mobile in New York, 2019. And here you can see we have the mobile free clinic spots all over the United States. And for the free clinics, and we can never put any end. And is Dr. Wen online here? And Dr. Wen is not here online.
我们请放声音。我们请音控。
In 2019, and we also sent 2 trucks in New York, and one is the optical mobile, and the other is a dental mobile. And they are new mobile trucks that we sent in the United States. And they are the trucks in which we have the whole new facilities donated by hospitals. And this is the statistics of the mobile trucks in 2019. And we offer more than $1,017,000 value there. And we send a lot of students learning from Tzu Chi technologies. And for the second day, and students of Tzu Chi University help with the free clinic. And this is also the second day, and the students learn the whole process and the whole thing of the free clinic there. And these pictures shows you all the students of Tzu Chi learn skills from the dental mobile. And this is the pictures about the optical mobile, and students communicate with parents in English during the whole process of the free clinic. And it is students that learn to operate the medical records, e-medical records. And these are the pictures that students share their cases. And some patients here are also the care recipients here. And the students go to their homes and do the home visitations, and they witness the poor families and how poor they are, and how they make a living. And these are the pictures that students are doing the sign language performance. And here we have 5 students from Zhongtai Technology University. And here are students and from Tzu Chi Technology University and the Zhongtai Technology Universities. And here are the students who come here and participate in a free clinic of optical mobile here. And right here, they learn some basic skills of the optical department. And here we have students of Zhongtai and doing a free eye clinic here. And they stay there for a month. And originally they planned to stay here for 3 months, but finally they just went back to the US 1 month earlier. And this is my report. Thank you. And we still hold on to our belief that we continue our relief jobs, not because of the pandemic of the coronavirus. We didn't stop, and we held a lot of health forums that make a lot of people healthier. and we have a record and uploaded a lot of speeches and forums about health, and you are more than welcome to just subscribe to them. And what is good is that we have online health forums, and it is very popular. So I really suggest that you can just get online and try to watch them. And if more people come here and subscribe to our forum, and this is a very big encouragement to us. And we don't feel good because of the pandemic in the United States, but we are not defeated by this, and we are more encouraged that okay, because for last November, we delivered the masks and the PPE for China to the United States. And it is really sad that in China, it is now better. I mean, better in pandemic, but in March, the situation in the U.S. was getting so bad. So we decided to send all the PPEs back to the United States, and people loved this, and a lot of Americans volunteers really give us the positive feedback there, and we send over 7,898 volunteers there, and we delivered more than 1,300 PPEs there. And now let's all listen to the sharing of the the vice president in the United States.
Thank you to the Suu Kyi Foundation for this exceptional generosity of food and PPE. And we were asked to address how important it is to have healthy meals right now. So healthy meals for our staff means giving them the energy to continue to do all of the hard work that they're doing. And we know that the Suu Kyi Foundation prepared something flavorful and delicious. And for that, we are so grateful. We extend our friendship to all of you, and thank you so much. 他讲的内容就是说，感谢慈济提供在这个时间呢提供。
And what she says is all about the gratitude toward Tzu Ji that provided them vegetarian meals to keep people healthy during the pandemic. To advocate in the campaign of vegetarianism by Mr. Zheng Yan, now we have encouraged more than 2 million meals of vegetarian meals in the US. And now we have UCLA, we have bone doctors here, and they are here to carry gratitude to Tzu Chi volunteers that send them the vegetarian meals. And volunteers also send out the vegetarian lunch boxes.
I would like to pledge 2 meals a day.
Hi, my name is Carmen Martinez, and I would like to place a meal every day.
My name is Dolores Clark, and I would love to eat this meal 3 times a day.
原本以为只能够在门外进行交流，这次却破例让志工进入。
And originally we thought that we could just have such promotion outside, but we can just imagine that we just could send all the box lunch into the hospital.
A lot of people getting this nice meal from Suu Kyi. So I just wanted to say thank you very much. I really appreciate it.
Besides sending out a meal, and we really want to turn the stereotype of vegetarianism toward the people.
Healthy mask wearing, and also for healthy eating and healthy diets with a vegetarian promotion of food.
And especially the instant rice, which can be cooked just instantly, and they are so impressed. This is super delicious here. And I ate really very much, and they are just like hamburgers, but they are vegetarian. It's great.
Great it was, and plus Sister Mary got me some food to take home to the kids.
And to promote 10,000 people with 10,000 meals of vegetarianism, and we save the earth by doing so. And right here, I also wanted to share the volunteer recruitment under the pandemic. And I really thank our medical team very much. And we really encourage a lot of volunteers and nurses and doctors. And like Mr. Su Jianhua and his wife, and they are now in our team under the training programs. And we have also a Chinese herbal doctor here under the training programs. And there are 9 doctors and the nurses coming here for the training program. And thanks for all the volunteers that accompany them and safeguard the people's health and their aspiration. And Mr. Zheng Yan's aspiration that we want to promote vegetarianism and recruit more people in the United States. Thank you. Thank you.
Next, we'll welcome the Dr. Zhao from Taipei Tzu Chi Hospital to share with us. And also Dr. Su Guoren.
敬爱的上人、常驻师父、全球慈济人仁医会学员们
Dear Master Zheng Yan, Masters at Jinsi Above, and the global TIMA members, good afternoon. Here I'm on behalf of all the healthcare workforce to have a sharing with you. Most of the part for the TIMA in US, we have the free clinic. In the beginning, we have free clinic. So beginning from the 2003, we are going to apply from the US government to certify by the state government. Until now, we are still going to the paperwork. Hopefully, we will get the certificate by this November. What's the impact for us to apply for the certificate? The most important factor is the certification help us to build up the holistic healthcare service. Our goal is to serve the patient. The patient must be filtered by the government. And the goal is same with the Tzu Chi healthcare. So in this way, we are affordable to invite more professional physicians to come to join us. For example, in the past, we might be in lack of the medicine prescription. For example, who has the diabetic with the complicated symptoms. Now, if we have like, for example, like eye doctors to join us, then the eye doctors can help to provide the proper health care on the patient. So our goal is to safeguard the life and health and love, and to help to build the holistic healthcare service. Finally, we wish Master Zhen Yan a good health. Thank you. Thanks for the TIMA member from the US. Now, next, we have Dr. Zhao to share with us. Good afternoon, everyone. We have the big event of this January 1st in Taipei Tzu Chi Hospital. At that time, all the medical staff stayed until the midnight. We have the photo. As you can see, there is a clock showing up behind us. This reminds me the crisis of pandemic. On July 21st, because Taiwan has the first confirmed case, so the government call on all the medical health service to set up the emergency response units. So we just redeveloped our structure of the response units. So we block all the entry, just leave the entry for the car park. And we also to have most of the posts and electronic posts to make sure everyone in the hospital to do the proper protection measures. And also we launched the training program to educate the everyone to have the knowledge about the pandemic. So the doctor who in charge of the specimen collect need to be well protected by the personal protective gowns. So every time when they are going to contact with the patient, then they need to do the proper PPE measures. So also we have the simple collection checkpoint outside of the hospital. Before the specimen checking outcome is going to released. So the patient need to wait until the outcome is released. Because during that time it's winter, so I remember the first night there's a baby patient came. They are very cold and true. So we just borrow the cargo as a waiting checkpoint. But the procedure is very complicated, so we also set up a temporary restaurant. So after our emergent discussion, we have a layout of the outdoor fever checkpoint. The layout is very specific. As you can see, we need to find the vegetation space and need to make sure the outdoor space is enough for these prevention measures. we also set up the portable X-ray scanner outside. By February 19, we just started launch the setting up program. So very soon we just finish all the setup. In the inauguration day, we have the volunteer bottling to hold the inauguration ceremony. So in that afternoon, I was informed that there is an 85-year-old patient who had a fever, also receiving the dialysis treatment. So he has been transferred to the normal ward to the ICU. Then he was confirmed of the COVID-19. So at that night, we immediately need to check out who are those group the patient contact with. Dr. Mei Zhen said, even though there's some patients, they are not in high risk of contagion, then he make a phone call to us. For the 80-year patient who has been put into the ICU, we paid high attention to him. So at that moment, all those medical staff who contact with the patient was isolated. Among there are total 138 of them. 70 of them are in high risk, while the others in low risk. At that moment, I shoulder a very great pressure because such a severe condition patient stayed in our hospital for almost 2 weeks. So I'm very worried who else has been contact with that patient was missed out. So in the next day, I asked all those staff who contact with those patients to receive the specimen collection and arrange each of them to have the isolated dormitory. So each of them just carry the simple personal belongings to stay in the isolation dormitory we prepare for them. We need to deliver the 3 meals and take their forehead temperature regularly. So among the contact list, the 5 out of the 31 people, the patient is in charge, is hospitalized at our hospital. So one of the family member of the patient it needs to be isolated. So we set up another isolation area for those family member to stay in. As you can see, when we deliver the foods, we just leave the food outside of the ward and knock the door to inform the patient, the person who's been isolated, to come out to pick up the food. all this contact staff has been clear of the going overseas check. And in our hospital, we also have the proper arrangement for the isolation roads and the public area. Maybe each of us might remember we are suffer from the panic of in lack of the mask, a surgical mask. So I remember in the past, we have endless surgical mask. So, but at that time, everywhere are running out of the surgical mask. So the photo you can see the people just line up to buy the surgical mask. Even though the hospital can have the enough surgical mask, we still receive the every volunteer's support. They provide us a bunch of plenty surgical mask. So we are very grateful for the volunteer, their support to us. Their love and support to the frontline medical staff. Even the commercial company, they are sending us the sterilized robot. So Taipei Tzu Chi Hospital also support the quarantine work in the Songshan Airport. So when I'm asked who is going to support every staff of our hospital, they are willing to help. So I think the only solution is to purify ourselves by adapting vegetarian diet. So when Master Zhen Yan heard about those foreign workers who take care of those elder Taiwanese, who might in panic about contacting the pandemic. So Master just said, don't just focus on their identification. You need to make sure whether they adapt the vegetarian and diet and how to take care of the elder people. So we just provide them with the multi-language explanation on these protection measures. So the 80-year-old patient after our treatment, so we use the mobile phone to let the patient's family to know aware about the patient condition. So when the patient is in severe condition, we just use the mobile phone. And unfortunately, the patient couldn't go through this pandemic and finally just pass away. Then we still use the mobile phone to inform his family. So in this layout, the yellow and the blue dot indicates the virus. So as you can see, it's virus everywhere in the world. So we are very worried about our protection measure is strong enough. Because the patient stayed in ICU for many days. So, because we also have a many trained, experienced staff. So, including the mentalized hole, we will check whether there's a virus there. So another case, we also found that the virus in patients' throat sometimes is negative, sometimes positive. Also, Tzu Chi University invented the antigen test. And many patients stayed in the hospitals. We encourage the patient to adopt a vegetarian diet and encourage them to join the Tzu Chi events. So Thai flies, once we noticed the first case of a confirmed case, until now, it's 4 months passed by. We were really grateful all the support from all corners. This is the award from the government shows their gratitude to our hospital. This is what I'm sharing today. Thank you. Next, we're going to invite Dr. Xie Jinrong from Northern Taiwan TIMA to share with us. Master Zheng Yan, masters at Jinsi above, and TIMA members, good afternoon.
我们北区人医会在这疫情当中，虽然没有义诊可是我们也做了一些事情。
Today, I'm going to share with you the case of our efforts during the pandemic, even though we don't launch the free clinic during the pandemic.
相对全球的疫情台湾算是一个比较安全的地方。
Compared to the global crisis, Taiwan is much safer.
可是当3月30号我们听到
So that's why we have the blessed life.
在第一线纽约第一线的
When I heard Dr. Niao Jingxing from New York call for the support on March 30th, they are running out of surgery masks. So I just wonder what we can help, what we can collect, maybe some PPE equipment for them. So in the TIMA dentist, we call for all the TIMA members to join us. Doctors also collect some surgical mask after we deliver all those PPE equipment to New York. We just realized that in the past, we just like a joke, joking like in the past, the gangster must wear mask to rob the bank. But now people might bring the money to rob the surgical mask. So when we are going to collect all the PPE, we realized that our government is also collecting all the PPE. So after we deliver all the PPE to New York, so on March 31st, the volunteer morning assembly, Master Zheng Yan said that Due to the outbreak of the pandemic, it's also the opportunity for us to sincerely to receive the lesson. We need to resume our traditional to learn from the pandemic. So at this time, Master Zheng Yan called each volunteer to calm down because there's many doctors who commit suicide during the pandemic. I just wonder why. As you can see, there's a doctor from New York. And in Russia, 2 doctors commit suicide due to the pandemic. In US, every day, at least 1 doctor commits suicide every day. I'm so surprised. Just wonder when we are treating the patient, whether we treat our patients hard or not. I remember in the past we used to launch the study group activity. So in 2018, November 30th, Master Zheng Yan reminded us how have we watched a Taiwanese drama, 智者 Vulnerable. Master asked us to watch this Taiwanese drama of 智者 Vulnerable and also launch the study group. At that time, we were so surprised because we never done this before. Because I have never watched the Taiwanese opera before. So I also checked with the Dr. Ye to see whether Master Zheng Yan asked them to watch the same program. At that time, he said no. So I just reflect maybe I didn't have enough wisdom. That's why Master Zheng Yan asked me to do so. So from then, every day I just I just noticed that the Master Zheng Yan asked each volunteer to watch the 智者 Vulnerable program. So in order to make the program more familiar with the volunteer, so I just try to simplify the lyrics, make the lyrics more plain to our daily lives, and also put some video links on the study group material. Especially the background of the history is quite chaos. So I am very confused about this vulnerable background. So finally, I sum up the notes of the watching the Taiwanese drama and accumulated. There's a note about 183 pages. So later on, I should started to study the sutra at the same time while I watch the 智者 Vulnerable program. So at that time, I also try to collect as many video clips done by Dai TV. So when I'm doing so, I realized that why Master Zheng Yan focused on Lotus Sutra so much. So Master Zheng Yan's words might slightly to us, and I also easily forget what Master said. During hearing Master Zheng Yan's teaching, I just wonder how much percentage I receive from Master's teaching. There's a story in the sutra when the Sariputra is going to enter Nirvana, and Ahana is very sad. And the Buddha asks Ahana whether Sariputra entered Nirvana, has you let go of all your precept, samadhi and wisdom? And the Anna said, no. So Master Zhen Yan said that emphasize the importance of the Jing Si Dharma lineage and Lotus Sutra, because Master's hopes we need to take the sutra's essence into our bone marrow and to grow with us. In the past, when we just joined Shiji, normally we just wonder, stay healthy is normal. And how we are going to take those sutra essence into our body. The key point is to listen to Master's teaching regularly. And another case is by this on April 12th, we are going to launch the study group. So we started to consider each of us, we are located in different location, and we have a different time frame. So take myself for example. The leader, Sister Yulin, will assign the key point of each volume to each of the group member. So once we finish all the reflection, we will keep the electronic file online. So we started to set up so many groups, like the pharmacist or nurses. For nurses group, I really admired Sister Xuehua, who is going to set up the group at home and clean up her home, but accidentally she fall and broken her leg. So another group calls auspicious. All these groups are just like auspicious clouds, blown one by one. So after the study group, we will have the reflection and repent. Take this for example, how Ananda was rejected by Buddha to receive the female disciple. So that's why we currently have the female monistic norm. Because I'm running out of time, so I just jump to the final slides. September 6th, after we have a meeting with Master Zhen Yan, we wish Master Zhen Yan to have the Dharma wheel running of the world, and Master correct us, no. You should wish your wisdom can be growing forever. That's why we have the Buddha's teaching passed down. So after I heard the master's teaching, I have so much feeling. Finally, how we can stay with the master? Just like I said, we should listen to master's teaching every day. That's the way we grow our wisdom. Thank you.
Next, we are going to hear the sharing from the China, Dr. Huang Lihua. Dear German masters and dear Tzu families online, I'm from Wuhan, China. My name is Fan Lihua. From the January 13th, there's lockdown in the Wuhan, city of Wuhan, and on the street it's so quiet. We don't see people, and we don't see cars. There's the comparison. And even before the lockdown, there are medical professions. They're infected by coronavirus. And then back in that time, we don't have enough knowledge about this coronavirus. And before the coronavirus outbreak, we never wear goggles to conduct our medical services. This is our first experience to wear goggles. And after the lockdown on January 23rd, we are very afraid. We panicked because we don't have enough knowledge about this coronavirus. Everyone is very nervous. Myself and other medical professions in the hospitals, we encourage each other that we have the power, we have the profession skills, medical skills, and we also have the power to comfort the patients, and we have the power to calm the patient's mind. After January 23rd, your surge of the number of patients in some medical centers. But we have shortage of preventive medical material. So that night, we the members of TIMA, and also we have connection with city volunteers. We hope that we could collect medical preventive materials from the public and trying to help. They strive to help the medical professions to find preventive medical materials. And so we make the announcement to the general public that in the hospital, the medical staff need medical professions. They need the preventive medical care material. So we also get the feedback letter, and also the boxes of preventive medical material. When people volunteer to donate preventive medical material to us, and the PPE and also the goggles. They donate PPE and goggles, preventive gowns. And this is a letter from a little children. He says that I use the my coin banks that I save up for many years. The Chinese, I save up my the money from Chinese, the new envelope from Chinese New Year's. I saved up so many years, and my mom found her friend, and finally we got the support from overseas. We purchased the PPE and also the preventive medical materials, so we could wear these safety gowns. And this is the pictures that and the elder people, they don't have enough food in home, and so I shared what we have at home with them. And in this during the pandemic lockdown in the city, even sharing the food and is very important. And city volunteers, we organize 40 volunteers to collect medical materials. And in the situation in each hospital is quite different, and we need to confirm who is the recipient in the hospital of all these preventive medical material. So from we donated to 178 hospitals for the effervescent tablets. And many people who do not understand that why what we have done, the city volunteers donated the material, include the underpants, because they after they wear the preventive gown, their underwears are wet because of sweating. So they have shortage in the underwear too, and so city volunteer in China and city volunteer all over the world, all of them join their effort to support city of Wuhan. And also we have shortage of bed in the hospital, so we have this 自己 foldable bed to donate it to our hospital. And also we don't have the bus driver who is willing to deliver the materials to the hospital. So our city volunteer is volunteer to deliver this preventive medical material to the hospital, even in the winter time, and it's snowy and slippery on the road. And he's so brave to not afraid of the virus because he wanted to help out. the frontline medical professions, they don't have enough time to even worry about their meals or prepare their meals. They always eat instant noodles. So we've seen that many city volunteers like cook for the medical professions. But we hope that the volunteers do not come out. Volunteer need to protect themselves too, because we all need to follow the lockdown measure. And we also need to keep social distance, but they need to but the volunteer also still manage to deliver tasty vegetarian food to medical professions in the hospital. And also after our medical professions receive the 5-gram powder from Jinsi Abode, they give the grain powder to the patients. And more than 40,000 of medical professions, they offer their service to the patients. And also a lot of them, their workplace do not have air conditioner. And and medical professions, they usually don't tell the hospital authorities about how difficult they are. And the individual volunteer cannot enter cannot get into the supermarket, but the Tzu volunteer are allowed to enter the supermarket, but they wear the preventive gown. And so we also get the eye drop. And so every time city volunteer deliver the preventive medical materials, they always deliver on their own, because they obey the social distance order. And after the relax of the social distance order, we start the volunteer individuals are allowed to go out. We go out to 35. We visit 35 communities, and we deliver nutritious food, and also we deliver instant noodles and grain powders. Although we safeguard 10,000 patients, but these medical professions, they take care of more than 1 million residents in Wuhan. And Tzu volunteers, they are the first charitable foundation to offer their help for the frontline coronavirus medical professions. And in May, we we may pay respect, mourning for the loss of their life, the medical profession, who the frontline medical professions, they lost their life in fighting the coronavirus. And when our medical professions, they see materials from donated material from Tzu Chi, they are very touched. And also we also offer our care to the infected patient of coronavirus and their families. And some people, they have misunderstood some people, they have misunderstanding about the coronavirus. Even my cousin says that if someone is infected of coronavirus, we better not to have any contact with these patients for 2 years. But that is not the correct knowledge, because that saying is from out of people's fear. The patients who recover from coronavirus, they didn't get a fair treatment from in their community. So we need to help. We need to offer the warm care and encouragement to the patients who recover from the coronavirus. We are very grateful that Master Zhen Yan established Tzu Chi Foundation. So we in the darkness we see the light, that we can follow the path, and we have the right mind and the right faith. We have the strength to offer our love and care to the people in need. And no matter how late at night, after the sanitization of myself, I study. I listen to Master Zhen Yan's teaching. That's the most comforting period of my heart. And do we, because the limit of time, can we take a break? Please rise. Place palms together. Pay respect to Master Zhen Yan. Thank you, Master Zhen Yan. And we'll continue our session after the break. And we'll come back at 3:25. And we'll start our next section in 3:30. At 3:30.
静思静思，万物静思，静思人间喜缘惜福，无私的付出。法虽如戏，法中行事，慈悲智慧，自度度人。万法万物，静思静思，传承法爱，决心圆满，大爱行于斯。静思静思，万法静思，洗净尘垢，清净无染，菩提的心思。静思静思，万物静思，静思人间喜缘惜福，无私的付出。法虽如戏，法中行事，慈悲智慧，自度度人。万法万物，静思静思，传承法爱，决心圆满，大爱行于斯。静思静思，万法静思，洗净尘垢，清净无染，菩提的心思。静思静思，万物静思，静思 静思，传承法爱，决心圆满，大爱心于斯。静思静思，万法静思，洗净尘垢，清净无染，菩提的心思。静思静思，万物静思，静思人间喜缘喜福，无私的付出。法虽如行，法中行识，慈悲智慧，自度度人。万法万物，静思静思，传承法爱，决心圆满，大爱心于斯。静思静思，万法静思，洗净尘垢，清净无染，菩提的心思。静思静思，万物静思，静思人间喜缘喜福，无私的付出。法虽如行，法中行识，慈悲智慧，自度度人。万法万物，静思静思，传承法爱，决心圆满，大爱心于斯。静思静思， 的心思，情似金丝，万物静思，情似人间戏缘戏赋，不死的付出。发虽如洗，发中心事，慈悲智慧，自度度人。万法万物，静思静思，传承法爱，决心圆满，爱心于斯。
全体请起立，请合掌。向上人行问讯礼，问讯。大家请坐。感恩各位菩萨很准时的又回到了云端，因为呢，今年的病情呢很严峻，大家呢都有很多可以来跟我们做分享，所以我们每一个分享者都要把握好时间，可以留更多的时间来听上人的开示。那现在我们就要连接到菲律宾，请菲律宾的 Dr. Natha Navarra 医师来为我们做分享。请Dr. Ethel Navarra, Doctor, you can start your sharing now.
Master Cheng Yin, our brothers and sisters in TIMA, Amitofo. The COVID cases
Yes, please continue. We can hear you. Yes, Dr. Navarra, we can hear you. Yes, please start. We can hear your sharing now. Philippine Dr. Ethel Navarra, can you hear us?
Master Cheng Yin, our brothers and sisters in TIMA, Amitofo. The COVID cases in our country continue to increase. The latest count is about 311,000. In the beginning, a lot of our frontliners have died. Although the risk of getting the disease is very possible, our volunteer doctors continue to have regular clinic to give their service once more. Our life in the pandemic has also joyful moments. Birthday celebration in the Filipino family is a special occasion. One of our doctors, Carlo Nasol, this year have celebrated his special day by holding clinic in the eye center. Last year, his wife likewise celebrated her birthday during our medical mission in the southern part of the Philippines. These doctors have chosen to spend their special day in their bigger family with Chuchi. This indeed, to me, is a clear affirmation of their commitment to the mission of Master Cheng Yen in alleviating the suffering in this world. May I now present to you our story. Please play the video.
菲律宾的 Navarra 医生呢，向上人问好，也向全球的仁医菩萨问好。他跟我们说，新冠肺炎的疫情呢，在菲律宾仍然在攀升中。
says hello to Mr. Zheng Yan, and she said that they are still striving against the pandemic of coronavirus, and so many people have died because of this. And although it is very likely to be infected of the pandemic, but the volunteer of Tzu Chi still work on diligently and do their best to save people with the free clinic, and they use surgical operations to save people, and it is the way they celebrate their birthday. And because we have Tzu Chi volunteers there, and we have Master Zheng Yan's aspirations there, so they are very grateful toward Master Zheng Yan. In February, the center's volunteer held a free clinic there in February, and the free clinic catered to 91 elderly as well as nuns and personnel of churches, and they offer free consultations and were either prescribed with eyeglasses or gave schedules for cataract surgery. And having dedicated their lives to taking care of distressed elderly, in Catholic nuns of the Little Sisters of the abandoned elderly grown so poor until Tzu Chi held the free clinic.
When we see everything there, and after
And
everything is clear, it's very nice experience. Then thank you very much. Really, I appreciate so much your work to come here. Thank you, Master Cheng Yen. Thank you, Doctor.
原医会眼科医师蔡超勇，经过4年，
And Dr. Alex Suo is back at volunteering as a TIMA eye surgeon for years after he battled with leukemia. And now he is doing the chemotherapy.
Loss of their eyesight. Gusto kong may maitutulong pa ako habang binigyan kasi ako ng bagong buhay. At ito ang bagong buhay.
And with the second list at life that I have received, I intend to use it to benefit others, especially the needy. And 17-year-old farmer Rafi, auditor, sought help from Tzu Chi in February this year. And his eyeball got badly infected after grains of rice flew into his eyes. And we have TIMA doctor, a cornea specialist, and performed the surgery and saved his eye. I never thought that I can recover because Tzu Chi did what they could to save my eyes. And in March, the Philippines came to a standstill when the COVID-19 pandemic broke out. And in June, after the government eased down its travel restrictions, after 3 months, the Tzu Chi Eye Center and just recovered the operations. And to prevent from the spread of coronavirus, and all patients and the staff have to be follow up some measures of the prevention. And surgeries were also performed in accordance with the safety and the health protocols. And they serve 30 patients at the most a day. And we couldn't go to public hospitals because of the pandemic, and those hospitals care are so serious infected, so they can't just go anywhere. And under normal circumstances, clinical days at the Tzu Chi Eye Center and would just have an overflow with gifts and donations from the patients. And under the new normal, however, patients were discouraged from bringing essential items on their own, but this did not stop the patients from finding ways to express their gratitude. I gave those donations, and Tzu Chi Eye Center cares so much about my eyes. This is what I should do. And Tzu Chi told us that it does not matter how much you have, but you can just give sincerely. And such beautiful scenes of gratitude would not have just shown how much they are thankful. And if we allow the fear to paralyze us, and we stop doing everything, and it's bad for patients, what if it happened and they would just need our help? And the efforts of TIMA doctors to help in this unusual time is not confined to holding a physical clinic. And when the pandemic started, and TIMA volunteers just want to keep their elder parents safe, so they decided to take the parents and her patients online. And through online clinic, and the doctors just prescribe medicine, and they refer patients about what they should do. And if they need a physical consultation, then they will be introduced to the real clinic and hospitals. And there were those who expressed a willingness to pay her, but she would encourage them to donate it to Tzu Chi instead. And there are so many patients who lost their livelihood during this pandemic. And so why do I have to take away their chance of getting the medical attention that they need as well? And TIMA was established with a vision of curing sickness, helping people, and healing patients. And in a time of a pandemic, and TIMA volunteers in the Philippines embody these principles as they heeded for cause of their first aspirations. And their efforts have proven that in moments of crisis, it is love that gives strength, fuels courage, and builds up hope. And the great love is a power of the world.
Dr. Namara, you can start your sharing.
Our people look at Chuchi as a source of hope in this desperate time. We have to work more and assist those who need us. We continue because we love what we do. Ganan.
Many thanks to Philippine TIMA for keep spreading love during the pandemic. 刚刚呢，医生是跟我们讲说，他们把慈济呢。
And just now, the doctor said that she takes Tzu Chi as the hope of the pandemic, and they will be continuing helping people who need their love. Thank you very much. They enjoy what they are doing now. And thank you, the TIMA from the Philippines. And now let's go to Jordan. And we have Dr. Amen and Dr. Hakim, and they have a good sharing.
I'm Dr. Hakim.
Hello, Mr. Chen Yuan.
ENT from Syria. I live now in Jordan. And this year, in the Corona time, in the July month, despite the risks, it was necessary to go to Mafraq. To help refugees and poor people.
上人他的翻译完全就是他上面所讲的投影片。
Master, and what he says is just on the PPT as shown.
Tzu Chi has a lot of credit for helping refugees and poor people in the difficult situations.
慈济人医会呢，在救助病人的同时呢，也帮助他们呢，他们在帮助病人的同时，也帮助他们可以继续行医的生涯。
When I start work in the more organization, I found a big difference between Tzu Chi organization and another organization.
他说他在慈济人医会这边工作的时候呢，发现跟其他的地方呢，有其他的看诊的机构有非常的不一样。
With the Tzu Chi organization, I found the trust, love, and be careful with patients.
他说他在这边看到呢，我们真正的是用爱，而且是真的会来关怀这些病患。
Tzu Chi learned me how I can save the money for help people.
他说在慈济是用大家的捐款十分珍贵来帮助需要的人。
Big Bank, the Bamboo Goodness, learned me how I can save the money. For example, maybe an operation 400, I can do now one operation 185 GD.
他说在慈济这边呢，他们慈济愿意呢，把比较昂贵的费用呢，用更接近他们能力所及的方式，让病人来使用。
After this, I can help more people.
所以可以帮助更多的人。
After visited me to Taiwan in the last year, I changed today I'm another person. I promise our master for continuous work and help people. I miss you. I miss Taiwan. I miss Hualien. I wish and next year I can go to Taiwan, inshallah.
他说，他因为在这边，所以得到了新的生命，也希望他说他怀念上人，怀念台湾，也希望明年呢有这样子的机会呢，他们也可以回到台湾来参加我们的全球人医年会。
From Jordan, I send for all our sister brothers in the all world my love and my hope and successful.
他说他用他的他希望他能够回到台湾，然后也非常的感恩。感恩。接下来是他旁边的那位医师要做分享。
Next will be the doctor next to him, Dr. Aha, and he's doing his sharing now.
I'm Dr. Ahmed from Syria. I am an interventional cardiologist.
Dr. Aha is from Syria,
6 years back due to war in the Syria.
and he can do something for Tzu Chi.
他从叙利亚来的，然后来到约旦已经6年了。
And I started to work with patients, with people, with Syrian refugees here as a volunteer and as minimum price to help patients.
他说他在这边呢能够继续
Dr. Aha is from Syria, and during the pandemic, and he is happy that he could just save people with the Tzu Chi volunteers as a TIMA doctor in Syria and other countries, and they give free services.
Corona time in Jordan, everything was closed, and we started to work from home with the patients by telephone and by video, and we give consultation and we help patients by phone and by videos.
他说，在疫情的期间呢，他们也是在家里呢提供这些医疗的服务，
During
包
the
括
pandemic,
视讯啊，
and
然
he
后包
also
括一些
stayed at home
一些
and
简单的一
provide
些医疗
like
服
video
务这样子。
conferences and some simple medical services to people who need it.
Also, Tzu Chi organization sent to me patient to do for him cath and put him stents. They ask for this about 3,500 GD, and when I did the operation.
他说，曾经呢，有一个手术呢，在那边呢是需要3000多当地的费用。
I found and I gave medicine to dilate the coronary artery with balloon, and I reduced this operation, this cost of operation from 3,500 GD to 400 GD.
他说，他将这个手术费用，因为在慈济，所以可以从3500当地的钱降为400块，让省下的费用可以帮助更多的病患。
And save this money to other patients and other people as Tzu Chi organization patient.
他说，非常的感谢慈济。
And when I was in Taiwan last year in TIMA, I meet their people and all volunteers, all people, and they meet other with big smile. And I found kind of this people when I came back to Jordan. And I start to change my life to a positive side, to to meet people and meet patients with big smile.
他说，因为前2年他有回来，我不知道有没有听错。他说他前2年有回来参加全球人医年会，因为这样的缘故呢，所以他回去之后呢，自己有了改变，不会再那么的负面，可以更好的为病人来做服务。
Thank you for all, for Master, for Mr. Chen, and for the Zuchi Foundation, and for the volunteers here in Jordan and here in TIMA. Thank you.
他说：“谢谢所有的人，谢谢TIMA，谢谢慈济，谢谢上人，因为有我们，所以他们可以在那边做这样子的义诊服务。”他说：“感恩 ，Thank you to Doctor for sharing with us from Jordan。”感恩来自约旦的2位医师的分享。那紧接着呢，我们要来到
thanks for the 2 doctors from Jordan, and now let's go to Hunan, China, and we have Dr. Li Zhi, and she will be doing her sharing.
和慈济家人们，大家下午好。我是大陆湖南长沙人医李志，上人赐法号明奇，然后感恩全球人医年会给我这样一个分享的机会啊。其实相对于各位人医、各位师兄姐们的付出，那我呢其实只是在做着自己的本分事，所以觉得有几分的诚惶诚恐，感恩各位的善解和包容。年初乍然而起的新冠疫情啊，打乱了人们的生活节奏，那全国人民都被禁足在家。那这一段日子呢，我们心血管医科承担了医院发热病房的工作，我也被临时任命为发热病房的负责人。其实可想而知啊，当时我们作为一个心血管团队，面对这个陌生又有点恐惧的病毒啊，当时真的压力特别大，然后而且很懵，真的是摸着石头过河。而且面对和我一起奋战在一线的同仁，我觉得需要的不仅仅是担当和勇气，而是需要更多的智慧来安定人心。智慧从哪里来呢？每当我遇到困难的时候，我就特别喜欢听上人说法，因为每天熏法香，每天收看人间菩提啊，是我一天中最安静，也是最享受的时刻。因为往往能从上人的法里面找到信心和力量，定也能生慧，就让我拥有了去安定人心、做好发热隔离病房的管理、自利利他的智慧。所以即使面对的是临时克难的发热病房，我也会想很多办法去克服困难，协调好各个方面的工作，真正的让我们的医护们还有我们的病患们真的能够安心，然后我们一起开心齐心啊，共同奋战了57天，为医院保平安，圆满完成了任务。那在上人呢也不断的在开示呼吁，要戒慎虔诚，斋戒如素，人人素食，家家素食，非素不可，这是唯一的灵方妙药。我也如是闻如是做。在科室，我带动了护士长；在家里，我带着女儿一起轮流为医护们做好美味可口的素食，去安抚一线医护。从一线下来，在病房自我隔离的医护说，这是最幸福的隔离。那在家隔离的医生说，我都想来上班了。那在我们心血管科呢，医护都能够接受素食，因为从2017年开始，我们科就成为了大陆第1家素食进病房的科室。每周一的中午，充满了各方人士爱心体验的素餐传达给我们的全科的医护病患，持续至今。也是希望藉由这种素餐体验传达给患者，素食才健康，一定要改变生活方式，在每一位医护和患者的心中都种下了一颗种子。凡是在我科的患者我都会去劝素，只要有1、2位给我回应，都觉得比自己吃素还开心。那这一次疫情啊，师兄姐们除了给一线的医护送防护物资之外，还会问我们人医，看了能为逆行的医护还能做些什么的时候，我们就都说如果能送素餐就好了，最有温度，最暖人心。师 师兄姐们啊，听了后立即行动。半个月5082份素餐，蕴含了5082份爱与关怀，送达到了长沙10多家医院医护的手中，温暖了每一位医护的心，并且带动的是无尽的爱与善的循环。我们医院呢，也由刚开始的第一。
So what the volunteers brought was a cycle of infinite love. And since the first day that we delivered 27 bentos, in the last day we delivered 141. So we continued on for 1 week. So it was truly a lot of hard work for them. And they told us that the recipients told us that as long as you give us anything, we'd be very happy to receive it. And I share with my coworkers that as long as they are willing to eat what we bring, then you can keep bringing the meal boxes to us. So we also start doing environmental protection activities in the hospital, and our coworkers come to pick up these meals with their own bags, so that they do not produce more garbage. And a large proportion of our hospital staff are donating members of Tzu Ji. One of our doctors and his wife are also donating their members, and they have become vegetarians as well. Since joining TIMA in 2008, they have kept donating to different disasters to which Tzu Ji delivered aid. But because their work is very busy, they are unable to participate in activities, yet their love and compassion are always with the rest of us. A lot of volunteers bring food voluntarily to our hospital, and we also take every opportunity to promote vegetarianism to our coworkers here. And we're very happy to see that some of our officers here at the hospital are appreciative of the meals that we bring to them. They kept saying, "No, this tastes really good," and they joined us in promoting vegetarianism within our hospital. So I arranged for the few of them to go learn at vegetarian restaurants. And little did I know that a little while after, they brought their own work, their own vegetarian cooking to me. And I thought they really did taste very good as well. And through this process, we overcame a lot of challenges. For example, we needed to make this promotion, and the restaurants were also worried about the increased cost. And we also needed to get the support of our superiors. So although our cafeteria has not opened up a vegetarian window yet, but I can see that in the dishes that they prepare each day, I'm seeing more and higher percentage that are becoming vegetarian. So now at lunch, when I go to the cafeteria, I'm able to have fresh vegetarian food, and that makes me full of joy. So I can see a huge improvement from our cafeteria. As Master said, it is easier to get people to do good deeds than to get them to be vegetarian. But I have developed a lot of confidence in this that comes from the coworkers, our cafeteria staff. And for the next stage, I hope that I can help the cafeteria to educate more people about vegetarianism, to prepare posters, to show them to our superiors, and promote vegetarianism this way. Of course, whenever there is an opportunity to promote vegetarianism, that is not something I want to give up on. For example, going on a radio show, and we were able to reach tens of thousands of people. During that show, I told people about how vegetarianism can help increase the abilities of their immune system. And as a doctor, I hope to promote vegetarianism, not just to Tzu Chi people, but also to other people, such as students in schools, in elementary schools. It is there's elementary school that I went to that I thought was very interesting because that teacher came to my hospital, and after hearing me talk about vegetarianism, he was very inspired. So he started doing vegetarian meals at home, and he invited me to the school to share vegetarianism with his co-workers, the other teachers in the school. So in addition to promoting vegetarianism, I have also been touched by Master's Jingxi aphorisms. They are something that I appreciate very much because they help me to cleanse my own mind, open up my wisdom. I also put it into practice in my work. It is a spiritual medicine for them. As well, I write down the Jingxi aphorisms on the medicine slips that I give to my patients. And many of my patients are cured this way because it helps them gain a more positive attitude in life. Some of our patients come to me with depression, and I came to understand that this is because of the pandemic that's going on. And with the help of Jingxi aphorisms, I can see this patient turn around. After a few times, the patient was cured without taking any medicine, but just reading Jingxi aphorisms. There was a grandpa who came to the hospital, who came to stay at the hospital after we discovered diabetes during his health exam. He could not accept that he had gotten diabetes. So the doctor, who was very troubled and came to me for help, and as that grandpa stormed into my office, he would not allow me to speak. I told him that, oh, I'm sorry, it is our fault, because it is being angry is not good for your health. It is punishing your health with other people's mistakes. So after he saw this Jingxi aphorism on my wall, he quieted down and began to listen to me. So I thought the Jingxi aphorisms have incredible power in turning people around, and it allows people to develop good affinities with others. Very often, I think back to Master's teachings, and I am touched by her teachings, and I hope that I can become a disciple that Master expects. It is only with diligence and keeping the Dharma in our heart and putting into our action without deviating from the way that we can form a deep affinity with Master. I hope that Master will be healthy and continue to teach us for a long time to come. Thank you. So thank you, Dr. Lee, for helping us to promote vegetarianism. Next, we will go to Australia.
Dear Dharma Master Zhenyan, Master of the Abode, as well as family across the globe, good afternoon from Australia. On behalf of TIMA Australia, I would like to share with you just exactly how Australia TIMA have responded. Since January 22nd until September 30th, we have confirmed over 20,000 cases of COVID-19 patients. And among them, there are about more than 860 of them have passed away. From the graphics that I'm showing you right now, started from February to April, there was the first period, and then they will have the second session, started from Sydney and to Melbourne, and how the situation aggravated when the government had locked down to Australia. Till then, since then till now, that we have seen the drastic changes that have taken place in Australia. we can see it in all the government have to take aggressive action to this, and in order to follow the steps that the government have regulated, we try to see what we can do together with the TIMA members across the globe to adjust the way that we respond to it, and so that we have to constantly go online to closely follow the regulation imposed by the government. At the same time, to think about how the TIMA in Australia can help to lessen the problems in Australia.
澳洲的卢医师，您可以听，我们跟您现在连线，不知道情况如何？卢医师现在可以。
I think there is a connection problem because we have just lost Alice from Australia. She's now back. Okay, from different part of Australia, we have tried to go online to translate the regulation into Chinese, so that the Mandarin, so the people who reside in Australia will be able to understand what the government was trying to tell us. At the same time, same thing with what Master is saying or teaching, we have translated them and shared with them online of the recipes to promote vegetarian diet. And I think we're experiencing some technical problem again. So as soon as Alice is able to hear us, we'll be able to continue. Okay, she's now back. All right. All right. Okay, we're kind of stuck again. Because connection problems we have. We're kind of temporarily losing almost everyone on the screen. As you can see, we don't see a lot of people appear to be online, but then they are actually on. Okay, now Alice is back. So although the resources it seems to be very abundant in Australia, but then because of this COVID-19, it had kind of put everything off the place. So suddenly our government or country seem to be short of resources somehow. So therefore, we have allocated our resources here in TIMA to see where we're supposed to distribute the most needed areas, such as orphanage or nursing home and PlayStation, or places that have to take on the first aid or first line responsibilities. So here we have the sister Li Hou Yu, who is in the middle, who is talking to the hospital because she has a close connection with the hospital for a while. So then contacting with them to see if there is a need for us to share with them the masks was very, very crucial, very important at the time. So this is what we have done. And this is because Sister Hou Yu was a recipient of the bone marrow transplant and leukemia patient. She have a close relationship with them. So then our brother and sister from Melbourne have immediately come together to solicit donation and preparing for all the protective gears and masks, all the necessary goods for our hospitals and as well as the community we were reciting. So now I would like to share with you a video. So then over 41,000 pieces of a mask and then 1,300 protective guard as well as other protective gears. We have donated more than hospitals and nursing homes. So then this is the organization called Tsuji that have surpassed the boundaries of religious or any ethnic backgrounds, as well as the interfaith, in helping everybody and to be part of everyone's concerned and to be there to help us and help people. And this is kind of a video that we want to give an idea as what has been shown and aired in Australia. Found headquartered in Taiwan, that we were able to get the resources shipped to Australia, and together with the Australian headquarters, we have worked together with the hospital that have collaborated with us over time. So this is the number of the material goods that we have able to distribute, and it's together with the cloth masks and all other protective gears. And during the time of this COVID-19, we can see how the volunteers have worked in different locations in preparing for the relief goods, and to also prepare some of the carrying goods for family that were being locked down or quarantined, and each individually distribute or delivered the goods to the members or the people who were needed the most. And because there was a forced lockdown, and as well also the requirement by the government of Australia to be quarantined for 14 days before and after arriving to Australia. So this kind of relief goods and relief bags, it's even more important, and it helps to alleviate a lot of uncertainties or disturbance emotionally from Master's Jean's aphorism or Master's books. It was especially appreciated. So we received thank you cards and notes from kids and families, like I'm showing you right now, and how did our relief bags and help to lessen the pressure or lessen the anxiety for the families who are being quarantined or isolated. So together by August 31st, we have totally distributed over 3,295 sets of the relief bags to the people who were needed. And so next that I would like to share something with you is from our sister who were confirmed with COVID-19, and she was being confirmed, and then after that, Master's teachings as well as the family and brother and sister's love and care have helped her to come back with this COVID-19. Even till now, she's not yet fully recovered, but then she said she is truly grateful for Master to be with her at all time, even this most challenging time. Master's teaching have inspired her even more so to seize every second of her life and to understand the value, the importance of a life, what she can be of contributions, so that she hoped that when she's recovered from COVID-19, she can be back with us to continue to help and save the world. And because of this COVID-19, so we aren't able to be back there with everyone. But then, as Master have said, on September 24th, Master said to us that we need to understand that what is the Bodhisattva's mind is to be able to understand our values and our importance and our influence and our actions, how it can benefit people and as well as ourselves. So again, thank you very much. We were trying our very best all the way over here in Australia to put this Bodhisattva mind in action and love in action. We are very thankful for Alice for her sharing, and as well as everyone from Australia.
Okay, let's welcome Doctor from Singapore. Honorable Master and global families. My name is Jinya. My name is Xiangna. So during this pandemic period, that what Singapore showed that we will share with you. So my job is the doctor in a clinic. So any clinic that joined the PHPC the program that you should provide all the breathing treatment for the impact patient. So you can. So we provide the COVID-19 the exam. So it's a swab and send home. So this is all the progress that's showing from February to August. So totally is 453 that get impact for the breathing problem. So all the staff and the volunteer also join the every lunchtime that the program. So during the pandemic period, we also provide all the education regarding how to prevent get impact. Also, we also prevent the sanitary to the patient. Also, our staff, even though they are not all the vegetarian, but we mindfully want to promote the vegetarian meal to them. And as long as we have the bowl, then we believe that we can make it work. So now we are showing the video for the sister Xu Xiaozhen, how she became the vegetarian. So so before become vegetarian, that the clinic didn't offer the lunch. So I usually eat outside. So in my mind, I think that I'm not possible to become a vegetarian because all the meal and all the salad tastes so good. I'm not possible to stop it or give it up. But I know I have a digestion problem. But I think I can just eat a little bit less. But I don't need to just give up. I still can eat those meat. But even though every day I heard Master ask us to be mercy, to be don't hurt the animal's life, even though Master asks us, we have to be vegetarian. I heard every day, but I ask me every day that should I start? Should I start? But I never really start. So when I join one program that is care about the people is going to lose their life. So when I read all those that article, so that mentioned that cancer is from because the diet has problem. That's because the not vegetarian problem, and also for those senior people, they have a high blood pressure, high diabetes. Why they have such a disease? So I will ask myself because they are not vegetarian. So now I already become a vegetarian. So my digestion system already improved, and so when I not vegetarian, that when I swallow the food, I always was stuck. I have problem to digest. So I always suspect whether I have a digestion problem. It's a serious problem, but now it's improving because I become vegetarian. So I will observe myself for a couple of months where it's getting better and better. So not just for a religion, for your own health. So I will not just on purpose to promote vegetarian, but I will share my own case to all the people I know. So when I become 100% vegetarian, so the first I changed my digestion problem. The second is I lost my weight. That's quite important. So I think you will not you will be very familiar with the number 243. So in order to promote the vegetarian, the older brother and sister, that we want to get more and more people to become vegetarians. So we prepare all the meal to 1,100 staff to receive our loving meal. So we saved 678 chicken. So I'm working in this the Catholic hospital. So there's a chance that a sister asked me to share my experience to more people. So we like to organize like a 40 department to provide this vegetarian meal to share with people that to let them test the vegetarian meal. There are 89% people like after try the meal, they want to continue this vegetarian. So the vegetarian is not just for the health, also will protect this earth. So between the staff, so after they eat the vegetarian food, they also share. They used to think the vegetarian meal is oily and there's not enough nutrition, but now they find out, oh, it's tasty and also it's healthy. So they're willing to try vegetarian food, one meal daily. And my personal experience. So after this COVID-19, so all my family members become vegetarian, but I'm just quietly to become vegetarian. I didn't really promote very hardly, but I respect the life. I have the faith to work and to promote this vegetarian, to share how the benefit for this vegetarian food. Then gradually, my co-worker that they really feel the benefit, so they gradually and will like to try the vegetarian food. And during the lunchtime, so I like to buy all the lunch for my coworker. So even though for this coworker, they went out for lunch, they also will share with me that they went out to try the vegetarian meal. So I feel so happy that the impact is moving between the people I know. So during this COVID-19 period, that we use a lot of this online to connect with other people and to sharing. So now we will watch this video. Okay, this is the song to make about. So we vow ourselves just will be like Guanyin Bodhisattva's heart, and our heart will be gradually moved to vast, like all over this universe. So we should make our aspiration. So gratefully, we have such opportunity to show the sign language. So I will put down all my complaint and all the negative the words. So wish we will be all in the Buddha that all over the life. So because this job that we watch all the people that they give birth and they went to the end of their life. So our job is to protect patient, protect health, and protect love.
感恩新加坡人医会的分享，感恩你们在线上的
So gratitude to doctor from Singapore, and yeah, grateful for your diligent work.
Next, we will have Kuala Lumpur. We would like to welcome Dr. Shi Jiaying to come and give us her sharing. Dr. Shi, her microphone probably has a much lower volume than we would need, so let's wait until she turns on the volume. Dear Dharma Master Jin, Master of the Boat, as well as everybody, good afternoon. First, I would like to share with you a video clip. However, the 2020 New Year was different. When the news was going on everywhere in the world about COVID-19 on January 25th, the first positive case of COVID-19 was confirmed.
3月16日，马来西亚政府颁布行动管制令，于3月18日起为期14天的第一批次行动管制。除了生活需求及服务性单位，所有店家都必须关闭，借以管控民众出行，希望透过保持社交距离，减缓病毒传播。
The resources, definitely all the PPE, and we don't know when is the surge capacity may come. As you know, the numbers is increasing by time, and we are pulling manpower here. So definitely, but day by day, our usage of PPE is increasing. So that's why we always try to maximize our PPE and make sure at least we have for the next 10 days stock.
疫情严峻，工位危机，慈济雪龙分会主动驰援，作为政府与第一线医护人员的后盾。保持一个距离啊，多做工，少讲话，这样就是少传染啊。面对看不见的病毒，成立专业团队是支援防疫前线的重要基础。
环境一颁发出来的时候呢，其实很多人都还没有完全准备好。那时候我们就成立一个 COVID-19 的 call team 小组，里面除了有医疗团队之外，我们也有企业家、志工。那时候初步我们设定的方向是：第一，我们要补助政府医疗上的不足；第二，安定人心。
3月18日行动管制，慈济马上动员做面罩、打扫、重置病房及制作防护 PPE。
截至4月29日，全马 COVID-19 确诊人数高达5945人，医院的病床应接不暇。为了应付接下来的病患，早前双溪毛诺医院重新设置原先的麻风病房为新增新型冠状病房。在做好自身的防卫措施，60位慈济志工协助清理打扫。
60 CG volunteers helped clean the wards.
"抗疫期间，医护人员分秒都在抢救生命。慈济了解到双溪毛诺医院的医护人员无法外出购买餐食，
During the pandemic, medical staff took against the time to save life. Upon learning the medical staff and the hospital was not able to go out to buy meals, they began to prepare vegetarian meals for them. I was deeply moved to see that the words of encouragement on the lunch boxes sent by the Tzu Chi volunteers. Transcending the race and the ethnic group and the values, everyone have come together. This is as of now what Tzu Chi have prepared or distributed for hospitals and governmental agencies, as well as the private clinic. And this kind of love were deeply felt and are being broadcasted and reported through all the medias. We can see that there are a lot of people who have worked together, and there are reports saying that the people were questioning exactly why this is happening to me and why it is me. The kind of fear coming from the patients continued to escalate. The kind of fear for death and the fear of getting infected have motivated all the city volunteers in Kuala Lumpur to the need to go there to help them, and somehow what we can do to make this happen to help pacify the anxiety and the fear. So aside from the resources for the medical personnel, we have also come together and preparing stuff that I'm going to share with you here on this video clip. And this video clip that was taken from the website at the time when we were locked down, and there was, because the government wanted to make sure we can secure the first aligned medical personnel's safety. So then we have this video online and they're being airing everywhere in Kuala Lumpur. This kind of fear coming from the people who are infected as well as those who are quarantined forcefully or willingly. The kind of the hopeless and the fear continue to remind us the need to go out there to help, especially when those who are living with despair and nearly lost of hope. That's including the doctor who have overworked, overloaded. So we were wondering and were fearful that one day our doctors or first line personnel would actually collapse because of this COVID-19. Exactly who else and what else can we do? Who else will be the next to safeguard us? So then, together with our international school, we have come up with little cards and also other materials to put together. We begin to distribute these bags of love to different agencies and governmental agencies or local hospitals. And this is the clip that I want to share with you. I made this for the doctors and nurses.
无论有没有感恩卡，我们还是要工作。但2-3个月下来，有时候我们会感到累，特别是精神上会很疲累，身体也会疲倦。看到这些感恩卡，会为我们增加士气。
疫情啊，虽说是个大灾难，但人世间处处可见温情。志工们的无私付出、慈悲不松懈的态度，促成了很多大好姻缘。
Though the pandemic have imposed big threats to each one of us, but then the fact that we have worked together even more closely than before, the selfless love that connected us together, because this love that we have for each other, we care for each other, and then we reach out to the people, not only our distant, our close relatives, but in our community. So I'm very grateful to be part of this team, And what touched me the most is the fact that I have received a report found on the hospital and saying that they are in need of the safeguard gown, the protective gown. So they immediately talk with the volunteers in Kuala Lumpur, and when we can distribute those protective guards to them. I remember at a time when we were thinking about how we can do it. We have gotten to the discussion with other volunteers who might also be very occupied or are also have a fear of getting contaminated. So there are a lot of discussion that require a lot of wisdom. And so I remember at a time when I was being told that I have been isolated by one of the volunteers. When I heard that, I was shocked, because when I heard I was isolated, this kind of just astonished me. I was a little bit saddened by this. I wanted to withdraw myself from this. I also was very I started to question myself whether I was qualified to continue leading this team. I think because of this made a very big impact on me. So I remember when one of the classes that I've attended during the diligent courses that I attended, that to how we should use any kind of challenges to cultivate our wisdom and to motivate ourselves, empower ourselves. As long as we're walking on the right path, having the right view, then we'll be able to empower ourselves. And this kind of power will be able to make us more brave and fearless. And because of this kind of lessons and this teaching, it reminded me so that I'm still unable to walk on this path. Though that I'm still far away from what everybody have done, but I want to share with you that I'm very determined to walk on this path together with everyone. Again, thank you very much for Dr. Shi's sharing. And aside from saving everyone else, we hope that all the doctors and nurses will also take good care of you. Next, we'll also have the Malaysian brother from Penang.
Dr. Tsai, we're not hearing you.
Hello， 我们连线可能有一点障碍，我们还是没有声音哦。亲爱的上人，
Oh, dear Master.
听到了，感恩。
Can you hear me? Dear Master, Masters of the Abode, and all TIMA members around the globe, and all family members, Amitabha. My name is Dr. Tsai. I am a specialist doctor. I work at a private hospital, and today I'd like to represent Malaysia and report to everyone what we have been doing. We were established in 19 years ago. When we were first established, our staff from the got their ropes from the CEO, and they were full of they felt very emotional, and because of this being deeply touched, we kept giving of ourselves, and we are very grateful to all the doctors, all the nurses, and all the volunteers for their contribution, selfless contribution over the past 19 years. Because of the pandemic, we joined together over the internet to join together, and we have over 300 of us gathered together online at the same time to give to enjoy these desserts together. So we had a tea party online, and we had four different people sharing their experience. We can feel that they are full of Dharma in their actions. we had a brother who got his robe from the CEO at that time, and that robe came with his name. And today, Brother Jirong, he is still part of TIMA, contributing. And this year, we are sharing our stories with each other. And we share with each other over a period of 90 minutes, but we had such a good time with each other that we did not want it to end, so we stayed on the line. Two of the brothers and sisters shared with us how much more joyful they had become after adopting a vegetarian diet. And we have the goal of respecting life, of purifying people's hearts. And we also have we share the goal of protecting lives and protecting people's love. We know that as members of TIMA, what's most important is for us to treat people's hearts, people's minds. We have 3 dialysis centers, a free clinic center, and we also have free clinics for refugees. We also have community medical outreach. And this is a summary of what we do in our community medical outreach and care. So we go on home visits, we have educational outreach, and here we see our dialysis center in its early days in Penang. And this is what it has become recently. It was built in 2015. We have other dialysis centers and our volunteer health screening, medical home care. And in Malaysia, we have one of the highest rates of coronavirus. So we have a lot of work to do in this aspect as well. And so I'd like to report to everyone how we've been doing. We want to help people. Can be in the it can take different forms. Maybe helping them with their housework, maybe helping them with their finances, and we also come together to produce personal protection equipment and to protect people's health. And also we try to help people overcome their emotional obstacles. And we're very moved to see a lot of volunteers who overcame their own challenges to give their love to others. We also go to different government departments to see what they need. For example, we invited the police to come visit us, and we also went to the police department to see how we could help, because they are also the people on the front lines. So we were very fortunate to be able to distribute our relief supplies over the past few days to different hospitals and also to our department, the National Department of Health. We had paid a visit to the department and also introduced Tzu Ji to the leadership of the department. And we had a lot of media coverage for the aid that we had given. This is a summary of the aid that we have provided to different medical facilities. We also donated COVID-19 care packages to people, families who were affected by the pandemic. And because of this pandemic, so this is a tally of what we had distributed. And because the pandemic is very traumatic for our world, Master expects us to come to a great awakening and to adopt a vegetarian diet ourselves, as well as promote it to others. And as a disciple of Master, how do I promote vegetarianism in our hospital? Well, when we were having a gathering in our Jingxi Hall, we invited medical staff and we gave them vegetarian food. So for many of them, it was the first time for them to have a vegetarian meal. We invited a nutritionist to share a scientific account of how vegetarianism is beneficial. And many of the people in the attendance were Christian, but so they were unwilling to change at first. But every time I see them, I talk to them more about vegetarianism. So before the hospital had agreed to make this official policy, I vowed to use my own money to buy vegetarian food for other coworkers who were willing to adopt a vegetarian diet. And in August, finally, our boss agreed for us to promote vegetarianism in the hospital. So we prepared a poster for this, and we prepared a vegetarian promotion card. We gave that to our medical staff. And with this card, we hope that our medical staff can sign up to a number of vegetarian meals, and we would give environmental utensils to help them encourage them in the effort. Basically, our vegetarian card, when we sent them out, we sent over 110 pieces of these cards, and this does not include our inpatients, because our hospital had gone all vegetarian. So all the inpatients, as well as the people who eat at our cafes, all receive vegetarian meals. And at the time, we also brought this vegetarian card to give to the family who came to visit the patients and share with them the benefits of vegetarianism. And CEOs of another organization came to our hospital and observed how we promoted vegetarianism. And this is our plan for next year. For January 21st, we are going to launch Meatless Monday movement in our hospital, as well as promote Earth Ethical Eating Day. We also like to share that Master has told us about that we need to sort our garbage and resources. Otherwise, if we bury them, it'll contaminate the soil, and if we burn them, it pollutes the air. It is just like our own personal habits. If we do not sort through our habits, then we also will be a polluted being. It's like saving garbage into our own hearts and minds. And if we closing ourselves off and being unwilling to soften ourselves. So I feel like we also need to sort through our good habits and bad habits. That is the ending of my report. Thank you, Master. Thank you, everyone. Let's look at the video if we have time. Thank you, Dr. Tsai. And we'd like to also give thanks so this year, the TIMA convention is held online, just like the convention in Malaysia. Next, we go to China to hear sharing from Dr. Gan Yehua, dear Master, Master of the Abode, all Tzu Chi family from around the globe. Hi, everyone. I am Dr. Gan from Beijing. Currently, I would like to tell everyone in the past 2 years how I have promoted vegetarianism, how it began. It was back in 2018. I came to the TIMA convention in Hualien, and during that convention, I saw the different activities of TIMA, and I was very moved. And deep in my heart, a voice told me that I should participate more in these free clinics. But in China, it is very difficult for us to do free clinics. However, in the TIMA convention, I had come to understand the necessity and the meaning for vegetarianism, and I developed a high confidence for it. And from the encouragement of my wife, I vowed to promote vegetarianism. So these photos show what I was doing when at the end of the 2018 convention, I made a vow, and this is the moment when I did it. So after coming back to China, I went through textbooks of nutrition and did research. I read relevant papers and books, and from an analytical point of view, try to understand the benefits of vegetarianism. Finally, I have come to conclusion that a vegetarian diet is the best option for maintaining a good health. This is the first time that I have promoted vegetarianism, and that is my experience. With the invitation of one of the sisters, we went to the park in Beijing and put up a banner. And I spoke to an audience of about 50 to 60 people. And that was my first experience promoting vegetarianism. And the contents of that time were quite incomplete. However, Brother Din came to me afterwards and told me that, wow, I didn't know vegetarianism has so many benefits, and I'm not going to eat meat again. His sharing gave me a lot of confidence and encouraged me to continue my work, my research from a medical and nutritional point of view. So I went to the Suzhou Ciji campus to give a talk to the family members of cancer patients. I've done this 4 times, giving the talk to over 1,000 people. And over these 4 conventions, I took the role of a speaker. And one of the sisters told me that after hearing my sharing, the person was felt quite benefited, and she wanted to promote vegetarianism to her friends as well. As we know, cancer patients are worried about their own nutrition, and many of them end up consuming more meat. But meat is conducive to the spreading of cancer. So it is better that people adopt a vegetarian diet to slow the growth and reverse their cancer. So under the invitation of one of our sisters, I went into different companies to promote vegetarianism. And some of the staff told me that they want to have more vegetarian meals from now on. And some people have also become donating members of Ciji. So this is what we do in our own hospital. I try to bring our medical staff toward vegetarianism, toward environmentalism. As we know, many medical workers actually do not receive adequate training in nutrition when they were in medical school. So through this sharing, one of the professors told me that it was the first time that he had come to understand that vegetarian diet is the best for health. And all of the people in our department came to, the staff in our department have also made a vow to renounce using disposable utensils. So this is my sharing in Ciji study groups in Beijing, promoting vegetarianism. This is my work in the community to the elder people. Many of these senior citizens have chronic illnesses, so promoting vegetarianism to them is very meaningful. So this is my promotion of vegetarianism in the Ciji Books and Cafe in Beijing. And we've also gone to other Buddhist organizations to promote vegetarianism. And many of these Buddhists are already vegetarian, but they were worried about whether they were getting enough nutrition from a vegetarian diet. Some of them still have diabetes. Some of them still have high blood pressure. But then they came to understand that it is because they were not eating a healthy vegetarian diet. They're still consuming a lot of lipids and other unhealthy things. They still need to reduce their consumption of salt and sugar as well. Here is doing the sharing in Tsuji campus to Tsuji people about the benefits of vegetarianism. And here is I'm sharing the vegetarianism to students and also to sharing a China Fit, which is conference for health and fitness promoting vegetarianism to the general public. There were over 100 people in attendance and I received a very good response. I also met a few people who became good friends and they are introducing me to different occasions for me to promote vegetarianism. I also had the opportunity to go online to share vegetarianism to nurses all around China. It was my first time doing this online. This was happening actually during the pandemic. And this is an important step for me to do my sharing online to share the benefits of vegetarianism. I have done 22 of these online sharings, having reached over 10,000 people. And one of the groups is an 8,000 people group of breast cancer patients. One of the people in the audience told me that she must adjust her diet. She must eat more natural foods and vegetarian food. And in Guangdong, we have another volunteer who turned my sharing into a video and put it online. It has been played over 5,000 times. And since the beginning of the pandemic, Master has kept telling us that we need to become vegetarian because of this pandemic. I have now given 63 talks. Now I want to make a vow to promote vegetarianism for all of my future lifetimes. Thank you, Tsuji family. Thank you for your help, and thank you, Master, for creating Tsuji. Thank you again. Thank you, Dr. Gan, for your sharing, for taking Master's Dharma into your heart and sharing it with the rest of China online. So this concludes the sharings for today. Would one of our CEOs or superintendents like to give us some feedback? Master and TIMA members. I have just heard everyone's sharing from different parts of the world. This is definitely a different convention from the past. In the past, we see you going to different places for free clinic, but now the sharing this year is very different. First is we provide PPEs and other supplies to hospitals that need them. Secondly, we see people doing study groups. We see these happening a lot. And thirdly, what I feel very moved by is the promotion of vegetarianism. We see that in different countries from Master's expectations of us, we are doing this with a lot of effort, not just providing vegetarian food, but also providing these talks and spreading them. I believe that every one of us in TIMA during this time, besides being pious and sincere ourselves, we repent what we have done wrong in the past. Very importantly is to be vegetarian ourselves and promote vegetarianism. I think we have seen a lot of very encouraging results from different countries. And the promotion of this vegetarian concept has dispelled a lot of myths and misunderstanding that people have about vegetarianism, such as vegetarian food being not tasty, not nutritious, or that it creates other diseases like gout or other malnutrition. So these are all dispelled, and people are coming to the correct understanding. So with this pandemic, that we've been living with for about a year, it's been about it's nearly a year now. This is indeed very difficult time, but we have not let this time pass by emptily. We still have done still a lot. Thank you. Dear Master, Master of the Abode, and all TIMA partners and brothers and sisters, good afternoon. It is indeed, having been part of this sharing for many years, I was expecting this year to be very boring because we don't have an agenda, we don't have activities. Then how do we represent what we've been doing? But what I have heard is beyond my expectation. Not only have we gotten what people needed to them, we provided medical supplies just in time. This is definitely indeed full of gratefulness to Master for us to have this effort go across so many different continents, Americas, Asia. We saw in the doctors in Syria who can become part of TIMA in Jordan to help Syrian refugees in Jordan, and also bring Master's care to the patients that they look after. That I'm truly moved by that. And of course, the promotion of vegetarianism and the taking in of dharma, that is something that we remind each other to do very often, as that is very important. I have just heard the statistics. We have over 2,155 people listening to our sharing online. So this means that through our modern technology, we can allow more people to understand that if each one of us is able to contribute a little more, then the world has a possibility of changing. But if we lock ourselves in because of this pandemic and we're unwilling to go outside into society, then nothing will change. But because of TIMA, we can allow this change to happen. We are a promoter of this change. And this year, the theme is promotion of vegetarianism. So let's look forward to tomorrow afternoon. There are 2,155 people joining us online. Please don't forget to join us again tomorrow, because we have Vice Superintendent of Tzu Chi's Darling Hospital, and they go to different parts of Taiwan and other places to talk about vegetarianism, as well as our medical CEO and other volunteers. We also have something that is more active. We have people among us who are not so good at cooking, but they still try to cook something for themselves. And one of the myths we're trying to dispel is that vegetarian food is bland and boring. That is not the case at all, because vegetarian food can be so tasty and can be so amazing. That is what we want to share with everyone tomorrow. And tomorrow morning, from the beginning of the opening ceremony, I hope you won't be missing it, because that will be a true pity. dear masters of the abode, and all Dharma family online. Actually, during break, I talked to our superintendents and staff. Especially, I've just heard our family in China. They're sharing. They are truly have a big job. I think that Master is leading us with love, with goodness, and Taipei Tzu Hospital has just taken care of a patient like this. He came to our hospital with fever. They come to a hospital with a fever, so we screen them for COVID, and all of them turned out to be negative. We've only looked after one person who were very serious. And so as we look at other hospitals around the world who see so many patients passing away each day, the hospital staff working so hard to save people's lives, but their own family and friends avoiding them because they're also afraid of contacting COVID-19 as well. Master reminds us to care for each other. And in the hospital, the doctors, nurses, and patients and other workers, I feel that love and care for each other is the most important in this pandemic, and that is when we see human strength. And I so did not expect to see that our TIMA members have put so much effort into promoting vegetarianism in the different countries, because they're not physically close to Master Cheng Yen like we are very fortunate to be in Taiwan, but they still work very hard to promote vegetarianism in their hospital to their patients everywhere they can go, and even making a vow to do this life after life. I think that is what moved me the most today. I think just feeling deeply touched is not enough. When we return to our hospital, I need to put more effort into leading everyone on this path and also learn from more members of TIMA. And also follow Master's teaching to use our love and vegetarianism to care for the environment and for everyone. Dear Masters of the abode, and our Deputy CEO of our TIMA members from around the world. Hi, everyone. As we've just heard, we've heard sharings that involved taking care of patients. If we just heard from Superintendent Zhao, we look after so few patients, 70, 80 patients in Hualien. I think that if we are stumped by just 70 or 80 patients in the hospital, then we wouldn't be a high-performing hospital. But indeed, I think he's doing a good job and doing a very proper job as well. I feel that what I've heard from Wuhan, we see what the medical staff and the admin staff go through, that the pressure that they're under. It is something, definitely the TIMA convention this year is very different. We've heard very different stories this year. And this time, it really strikes home to everyone. Some hospitals are fortunate to not have any COVID cases, including Hualien. And I think that we want to thank everyone for washing their hands often, for wearing their masks to help contain the spread of the disease. And I also want to thank the Master and Masters of the abode for encouraging us to promote vegetarianism during this time, because it is certainly easier during this time that people are more open to these ideas. I heard from Dr. Xie, because he cannot go on free clinics overseas, so he started listening to Master. Master wanted him to to watch the series on Master 智者. So the doctor is taking Dharma to heart as something I also want to learn from. And over the next half year, 1 year, I think that the pandemic will be controlled by middle of next year at the earliest. I think in the near future, we need to protect ourselves, protect other people around us, and also promote vegetarianism. That is something that I think I can learn from. Finally, I want to thank Master, because whether it be there be the pandemic or not, our hospitals are grateful to Master, and because we are in support of we're very grateful to be in Tzu Chi, because we're able to get the medical supplies that we need to protect ourselves, to protect others, protect people we need, protect people who are not able to afford these supplies, and to bring this stabilizing force to our world. I'd like to thank Superintendent Jian for organizing the TIMA convention this year under such special circumstances. So thank you all doctors for your sharings. Next, I'd like to ask for feedback from the Deputy CEO.
Dear Master, and all of those online, all our TIMA members who are online at this moment. Dear Master and Masters of the Abode and everyone online, I'm very honored to invite Professor Lai. He is very respected, and he will be giving us a speech tomorrow. So he will be explaining to us about the coronavirus. So back in LA, when he was there, that it was his expertise. So he is a virologist who knows the most about coronaviruses. So he was also Cheng Kung University's president as well.